Imagine your heart is a house with 4 rooms. Blood flows between these rooms through doorways or valves. One of these valves, the mitral valve, lets blood flow from the left atrium, the top left room, to the left ventricle, the bottom left room. In mitral stenosis, this doorway narrows. The mitral valve becomes thick and stiff, making it harder for blood to pass through. Imagine trying to squeeze through a partially closed door. It takes more effort. This narrowing obstructs blood flow, putting extra strain on the heart. Think of it like a traffic jam in your heart, slowing down the smooth flow of blood. This can lead to a cascade of problems as the heart struggles to compensate for the restricted blood flow. When the mitral valve is narrowed, the left atrium has to work harder to push blood through. This extra effort can cause the left atrium to enlarge. Imagine a balloon being constantly inflated and deflated. Over time, it stretches out of shape. Similarly, the enlarged left atrium becomes less efficient at pumping blood. This pressure can even back up into the lungs, causing shortness of breath. It's like a hose with a kink in it. The water pressure builds up behind the blockage. This chain reaction highlights how even a small problem with one heart valve can have significant consequences on overall heart function. Think of your heart as an orchestra, with each beat carefully timed to create a harmonious rhythm. Atrial fibrillation, or AFib, disrupts this rhythm. The atria, the top chambers of the heart, quiver or flutter instead of beating effectively. This chaotic rhythm disrupts the smooth flow of blood through the heart. It's like the orchestra playing out of sync, creating a jumbled and ineffective sound. AFib can cause a range of symptoms, including heart palpitations, fatigue, and shortness of breath. In some cases, it can lead to more serious complications, such as stroke. Section 4. A troubling connection: mitral stenosis and atrial fibrillation. Mitral stenosis and atrial fibrillation are often linked. The pressure buildup and enlargement of the left atrium caused by mitral stenosis can disrupt the heart's electrical system. It's like stretching a rubber band too far. Eventually, it loses its elasticity and can't function properly. In the heart, this disruption can trigger the irregular heartbeat of atrial fibrillation. The combination of these conditions puts additional strain on the heart and increases the risk of complications. It's crucial to understand this connection and seek prompt medical attention if you experience any symptoms. Section 5. Seeking help, treatment, and the importance of early detection. The good news is that both mitral stenosis and atrial fibrillation can be managed with appropriate medical care. Treatments range from medications to regulate heart rhythm and blood flow to minimally invasive procedures to repair or replace the damaged valve. Early detection is key. If you experience symptoms like shortness of breath, fatigue, or heart palpitations, consult a healthcare professional promptly. Remember, your heart health is paramount, and seeking timely medical attention can make a world of difference.